Hello, gentlemen. If you've crossed the milestone of 50, 60, or stepped even further into life's journey, and lately you've noticed something puzzling during your most private moments, you reach that peak, you feel every wave of that intense pleasure, but then you look down and notice nothing is there, then what I'm about to share could be the most important health information you hear this year. Maybe it only happened once, but that single moment sent your mind racing with worry. Or maybe it's been happening quietly, repeatedly, and you've been carrying this secret alone, unsure whether to feel embarrassed, scared, or both. My name is Dr. Emily Carter. I'm a board-certified urologist who's dedicated the last 12 years of my career exclusively to men's health, working with thousands of men just like you who are navigating the natural changes that come with living a full, vibrant life. And right now, I need you to hear something that might completely shift how you're feeling. What you're experiencing doesn't mean your body has betrayed you. It doesn't mean your manhood is slipping away or that your intimate life has reached its final chapter. Not even close. Here's a better way to think about it. Your body isn't broken, it's communicating. It's sending you a very specific signal. And once we translate that signal together, everything becomes clearer, less frightening, and entirely manageable. So stay right here with me, because over the next several minutes, we're going to uncover the real reasons this happens, identify the warning signs you absolutely need to recognize, and most importantly, walk through the proven, practical solutions that modern medicine has available right now to help you reclaim your confidence, your peace of mind, and your complete well-being. But before we get into what's happening when the fluid disappears, let me paint you a quick picture of how everything is supposed to work when your body is firing on all cylinders. Imagine your reproductive system as a finely tuned symphony orchestra, where every instrument must play its part at precisely the right moment. Your testicles are busy manufacturing sperm. Your seminal vesicles contribute the majority of the nutrient-rich liquid that makes up the bulk of the volume. Your prostate gland adds its own special protective fluid into the mix. All of these components gather together in the urethra, waiting for the signal. When that moment of climax arrives, a series of specific muscles contract in perfect rhythm, like a coordinated wave, pushing that entire fluid mixture forward and releasing it outward. The whole event happens in seconds, but it requires flawless coordination between your nerves, your glands, and your muscles working as one unified team. Now here's something critical that many men don't realize, gentlemen. The sensation of climax and the physical act of ejaculation are actually two completely different events. Climax is that intense rush of pleasure you feel. That's controlled entirely by your brain and your nervous system. Ejaculation, on the other hand, is the mechanical process of actually expelling the fluid from your body. For most of your adult life, these two things have happened together so smoothly that they felt like one single event, but they're powered by entirely separate systems. What we're focusing on today is something called dry ejaculation, the medical term for when a man experiences that full sensation of climax, feels every bit of that characteristic pleasure, but then realizes there's little or no fluid being released. Some of my patients describe it to me as feeling like an empty finish. And I completely understand why that gap between what you expected and what actually happened creates anxiety. For decades, you've associated a visible physical result with that moment. But here's what you need to understand deep in your bones. Your capacity to experience pleasure, that fundamental ability, can remain completely intact because it's governed by your nerves and your brain. What's changed is simply the delivery mechanism, the physical plumbing. This doesn't strip away your virility or your masculinity. It means there's a specific, identifiable reason why one part of your body's mechanical system is functioning differently than before. Quick pause here for just a moment. If this conversation is already helping you feel less alone and more informed, do me a favor. Hit that like button so YouTube knows this content is reaching the men who need it most. Click subscribe to become part of this community, and leave a comment down below telling me where in the world you're tuning in from right now. It genuinely lifts my spirits seeing men from every corner of the globe supporting each other and sharing their experiences. All right, let's dig into the 3 most common reasons why dry ejaculation happens. Understanding the why is your first real step toward taking back control. Number 1, The valve that won't close. Retrograde ejaculation. By far, the most frequent culprit is something called retrograde ejaculation. Here's how it works. Picture a tiny muscular valve positioned right at the exit point of your bladder, acting like a gatekeeper. When you reach climax, this little valve is supposed to slam shut tight, making absolutely certain that the seminal fluid has only one possible route to travel: forward and out through the urethra. But if this valve becomes too relaxed or stops closing properly, the fluid naturally follows the path of least resistance and flows backward into your bladder instead of exiting your body. You still experience the complete sensation of climax. Your brain registers all that pleasure. But because the fluid never makes it out, the experience feels dry. The telltale sign many men notice is that their urine appears unusually cloudy or milky the first time they urinate after intimacy. That's the seminal fluid mixing with the urine in the bladder. It's harmless, but it confirms what's happening. So what causes this valve to stop working correctly? Often, it's the result of certain surgical procedures performed on the prostate or bladder. These surgeries are medically necessary and successful at treating their intended condition, but they can inadvertently affect the delicate nerve pathways that control this tiny gatekeeper muscle. It's also a well-documented side effect of specific medications commonly prescribed for high blood pressure or an enlarged prostate. These medications work by relaxing blood vessels and smooth muscle tissue throughout your body, which helps your primary condition, but they can also relax that crucial bladder valve. I'll never forget working with a patient, a proud, dignified man who came to me feeling absolutely devastated after undergoing a necessary prostate surgery. The procedure had been a complete success, but when this issue appeared, he felt like his identity had been taken from him. Once I explained that this was purely a mechanical change, comparable to a door that no longer latches shut on its own, and that his sexual desire and his capacity to feel pleasure were completely unaffected, I watched the tension leave his shoulders. Understanding replaced fear. Number 2, the pathway is blocked. Duct obstruction. The second major cause involves a physical blockage somewhere along the pathway that carries seminal fluid. Think of it this way. The seminal vesicles and other glands in your reproductive system are still producing fluid exactly as they should. But imagine the narrow ducts that transport this fluid as delivery pipes. If one of these pipes gets blocked or obstructed, the delivery truck simply cannot pass through. The result is that the volume dramatically decreases or vanishes entirely, even though production levels haven't changed at all. What creates these blockages? Sometimes it's scar tissue left behind from previous infections, particularly severe cases of prostatitis that weren't treated quickly or thoroughly. In rarer instances, small calcifications, think of them like tiny pebbles or stones, can form inside these ducts and create a physical barrier. The symptoms can be subtle and easy to miss. Some men report a new, mild, aching sensation deep in the pelvis, specifically during or right after climax. Others notice that over many months or even years, the fluid has gradually become thicker and the amount has slowly diminished. Here's the encouraging news. Many of these obstructions respond well to treatment. Sometimes anti-inflammatory medications can reduce swelling and reopen the passage. When necessary, there are minimally invasive procedures that can clear the blockage and restore normal flow without major surgery. Number 3, the engine is running low on fuel, hormonal deficiency. The third major factor we need to examine is your hormone levels, particularly testosterone. Testosterone isn't just the hormone that drives your sex drive and helps produce sperm. It's absolutely essential for the proper functioning of your prostate and seminal vesicles, which together produce the vast majority of your seminal fluid. When testosterone levels drop below a certain threshold, the entire system begins to operate in slow motion. Production decreases. Function becomes sluggish. Early on, you might simply notice less volume than you're used to, but as the deficiency continues, other symptoms start appearing. Reduced interest in sex, erections that aren't as firm or reliable, and a general decrease in the intensity of sensation during climax. Beyond the bedroom, low testosterone often shows up as persistent fatigue, shifts in mood including irritability or sadness, and noticeable loss of muscle mass, even when your activity level hasn't changed. The medical term for this condition is hypogonadism, essentially a hormonal deficiency. But here's what matters most: it's treatable. A simple blood test can confirm whether your testosterone levels are below the normal range. If they are, carefully monitored hormone replacement therapy can often restore not just improved fluid production, but also your energy levels, your desire, and your overall quality of life. Too many men accept this as simply part of getting older and suffer in silence. That's a mistake. Age may play a role, but that doesn't mean you can't do something about it. Now, while the majority of dry ejaculation cases stem from these manageable causes, I would be failing you as your doctor if I didn't also address the situations that require immediate attention. Sometimes, dry ejaculation can be an early warning sign of something more serious developing, which is exactly why paying close attention to other symptoms is absolutely critical. When you need to see a doctor immediately. If dry ejaculation appears suddenly, out of nowhere, with no clear explanation, especially if it's accompanied by pain anywhere in your pelvic region, visible blood in your urine or seminal fluid, fever, or a frightening loss of sensation or numbness in your genital area, stop everything and seek urgent urological care. Do not brush this off. Do not wait to see if it goes away on its own. These symptoms can indicate conditions that need immediate medical evaluation. Certain neurological diseases, such as Parkinson's disease or poorly controlled diabetes that's been present for many years, can interfere with the nerve signals that control this entire system. In rare cases, specific types of urological cancers can disrupt either the physical pathways or the nerve connections. These are serious possibilities, but they are also conditions where early detection makes an enormous difference in outcomes. The emotional weight you're carrying. Beyond the physical mechanics we've been discussing, I need to acknowledge something else that's equally real: the emotional impact this has on you. For many men, the presence of seminal fluid has always been tied to their sense of performance, their virility, their very identity as a man. When it suddenly disappears, feelings of inadequacy rush in, anxiety takes hold, frustration builds. Many men start avoiding intimacy altogether because they're afraid of being judged by their partner, or because they feel fundamentally incomplete. Here's what I need you to hear clearly. The single most powerful step you can take to break this cycle is arming yourself with accurate information and opening up honest communication with your partner. Once you understand that this is a physiological change, a mechanical adjustment in your body's systems, and not a reflection of your worth or capability as a man, an enormous burden lifts. Your ability to experience pleasure, to achieve and maintain erections, and to share genuine, intimate connection with your partner, all of these can remain fully intact.